Hey everyone, and welcome to another Dr. Alicia Says video. So in this video, I'm going to be talking about some of the jobs that you can get as a therapist that are non-therapy related. So I say top 10, but know that this is not in order of significance. It's just 10 different options that you can think about when it comes to advancing your career in a different direction other than traditional therapy. So let's go ahead and get started. So first is being a mental health policy consultant. Now, that's more macro level. When you think about, I think, a lot of the laws and the policies that are being passed, a lot of times when it comes to mental health and behavioral health, there are people writing those policies. There's people providing, different insights and perspectives so that hopefully those policies really advance mental health in general. So that's one of the many things that you can do as a therapist because you went to school for it, you have a unique perspective, and you've also invested a lot of time and energy in your education. So, being a policy consultant can be a really great avenue, especially if you don't want to do kind of the one on one therapy thing. Second would be a corporate wellness coordinator. Now, this is another job that's typically on the macro level side of things as well. Usually, from what I've seen, these types of roles come from Fortune 500 companies or even large companies in general, where they're looking for ways to really help their employees focus on mental health in a way that hopefully increases employee retention and then also gives employees different tools that they can use that hopefully decreases employee turnover and also improves their well being in general. So, with these types of roles, a lot of times these are through EAP programs, and also companies sometimes hire wellness coordinators to provide programming, but also to provide resources and oftentimes support in traditional, but also sometimes in non traditional ways too. Another one is that of being a patient advocate or ombudsman. Now, this can happen specifically in hospitals. A lot of times, a hospital will have a patient advocate that's really the person that's been designated to address any concerns or issues that patients might have. Also, being an ombudsman, typically that's somebody that's employed by some type of state or some type of government, where they're really tasked with helping individuals who are a lot of times in skilled nursing facilities and other types of healthcare facilities really have access to the resources and also um, be able to advocate for themselves. So the patient advocate ombudsman space is a really great space to work in if you want to work a lot of times with older adults and if you want to work in healthcare. That can be a great option if you want to do something different than traditional therapy. Another one is that of being a mental health content writer. Now, this is a little bit generalized because there's freelancers, there's contractors, and there's also people that write full time. Starting out, you'll most likely have a lot of opportunities to do maybe more contract writing before you maybe get a full time role. But because we're talking more about mental health in general and we're having more conversations about what that means for daily life, there's definitely more of a need for mental health content writers. So there's a lot of different options when it comes to writing textbooks, when it comes to writing curriculum for therapy programs in general, when it comes to writing blog posts. These are all options and opportunities to really use your expertise in a different way. Another one is that of being a researcher or research assistant. For most of us, when we went to graduate school, we took at least one or two research courses. Now, I know that for many of us, research was not our thing, but if it was your thing and you really enjoy that, going into research can be a really great use of the skills that you learned in therapy when it comes to doing qualitative research or even quantitative research. If you remember some of the commonly used data analysis software systems and what that looks like, a lot of times when it comes to being a research assistant, they're willing to train you and they're willing to a lot of times write a letter of recommendation. This can be a great option to choose if you want to pursue a PhD at some point, but you aren't quite sure if that's the path for you, but you want to get some experience in that area. Going into research or being a research assistant can be a great way to kind of gauge if you want to continue on and maybe pursue a PhD or a higher degree. Another one is that of being a care manager, navigator, or case manager. Now, this covers a whole lot of different aspects, specifically in kind of in the healthcare environment. I think specifically of case managers that work in hospitals. There's case managers that work in other levels of care, inpatient, outpatient. Their roles definitely vary, but I think the overarching goal is that they really connect patients and clients to different community resources and make sure that they have the support that they need. And so, what that looks like can be different depending on the population that you work with. But it's definitely a great option when it comes to maybe using some of your therapy skills. I think sometimes in a more short-term therapy model, and it's more, I think, well-rounded when it comes to just connecting people to resources and answering questions and concerns as they arise. Another one is that of being an IOP or PHP group facilitator. I'm saying this because I put the asterisk there because it still is kind of traditional therapy and that you're doing group therapy, But this can be kind of flexing your therapy muscles in a different direction as you're working in a group setting and really help people really develop some of those coping skills and really provide an emotionally safe space for individuals as they're going through different mental health challenges and are navigating a lot of different things. So, being a group facilitator can be a whole different dynamic than working one on one with somebody. And so, while it's not necessarily a traditional one on one therapy model, it still does involve therapy. So, kind of put that asterisk there. Another one is that of being community outreach director. Now, this can look different depending on what part of the country you are. In these roles, I've seen a lot of overlap when it comes to advocacy work, when it comes to community organizing, when it comes to working with different nonprofits. This work can look different depending on your state, your city, and where you live geographically. So, a lot of times, these community outreach director positions aren't something that are typically remote. Usually, they're based in a physical location, but it can be a great way to find out, what's happening in your community and to get more involved in a lot of the work that other organizations in your area are doing. Another one is that of being a mediator. And so, you can mediate business disputes, you can mediate a lot of times divorces, individuals that are, trying to dissolve some type of contract. Mediation can be a totally different setting than therapy because there's a common goal, and both people are coming to the table, hopefully, with the intention of finding a solution. So, mediation typically requires just a little bit of additional training, and if you're a therapist and you've worked in therapy for a while, you already have a lot of the skills already needed for mediation, especially if you've worked with a couple or if you work with families in the past. You already have those skills. It's just getting that additional certification. For most places or most states, is typically an additional step of taking some courses or a course that gets you certified as a mediator within your state. Another one is being quality assurance or compliance manager. This really typically happens within healthcare settings or within, I've seen it usually also in health insurance settings where they're looking at some of the claims that have been submitted and really just reviewing and making sure that there's not a lot of fraud or any waste happening too. So this can be a job that tends to be maybe sometimes more tedious, but it's something that tends to have not a whole lot of patient contact. So if you're looking for a role that doesn't have a lot of direct care hours whatsoever, quality assurance and compliance can really be like your thing when it comes to maybe working remotely and wanting some flexibility, but also being able to look over notes and audit them as needed. This is a great role for that if you need that flexibility, but just don't necessarily want to talk to people all day, every day. So these are some ideas. Thank you so much for watching. Please be sure to like, subscribe, and share, and I'll catch you in the next video.